Well, before the break, we heard a lot about migraines, what it's like to live with chronic migraines, how to possibly treat them, and some new methods for migraine prevention.
One surprising treatment, Botox. Many look at Botox as simply as an elective procedure or maybe even something that's unnecessary. But the truth is Botox is a real medical procedure that is often used to treat chronic migraines. But there are a few requirements. You must prove to a doctor you have 15 or more headache days a month, each lasting 4 hours or more.
Well, funny enough, patients who've had surgical procedures done over the years have actually noticed their migraine headaches disappearing. We're talking about plastic surgery. Those who have gone under the knife for a nose job or a brow lift have actually reported that their migraines subsided. Now doctors think they know why and are using the technology for treatment. It's a common cosmetic surgery, removing the excess skin that is drooping on the upper eyelids. For some people, it could even help them see better. But now a new study finds that this plastic surgery procedure can be used to get rid of migraine headaches.
In the proper patients, this can be a very, very successful surgery.
Dr. Oren Tessler says doctors are discovering that the cause of some migraines could be that the sensory nerves coming down from the brain to the face and skin on the front sides and back of the head can get compressed. That can be caused by the muscles or blood vessels wrapping around them or a tight tunnel where they come through the skull. He can see the front and side nerves through the incision to remove excess eyelid skin. And during the surgery, under general anesthesia, take the extra step to free them.
That's the theory behind why this surgery is so successful. And we know it's very successful in the right group of patients.
In the study, 90% of migraine patients had more than 50% improvement, and more than half were migraine-free.
We can see, over 50% complete reduction, 100% never have to take medication again. These are patients that were not showing any relief from all known modalities of treatment that we have now.
And get this, some insurance companies may pay for this since the cost of migraines for doctor visits, medications, and missed work is very high. And if your insurance company doesn't pay, doctors and hospitals are working to make the procedure more affordable.
And plastic surgery can certainly have its positives, and it seems that more men today are turning to plastic surgery. A nip here, a tuck there, all to look younger. Let's take a look at the numbers. In 2012, more than 200,000 men underwent cosmetic surgical procedures. More than 1 million men underwent minimally invasive cosmetic surgery, and the stats show the numbers have nearly doubled since the year 2000. But what exactly are they looking to fix? Experts say they're looking to fix many of the same things women are, and they're coming in droves.
Brian Meuser is walking into his mid-40s with his head held high. But that wasn't the case a few short months ago.
I don't really want to call it a midlife crisis because it is so cliche, but, maybe it is.
And maybe this private investigator thought he could do something about it.
I've always kind of struggled with my weight.
So Brian made the move.
I don't shy away from telling people I did it. I don't necessarily wave a flag either.
What he did is what more and more men across the U.S. are doing these days. They're having some work done, as they say, plastic surgery, at a rate never seen before. The American Society of Aesthetic Plastic Surgery says the number of cosmetic procedures for men has increased by more than 106% since 1997. So what's behind this surgical spike?
The numbers started increasing, especially when we hit the recession.
So what are the most common procedures for men? Liposuction, or liposculpting, gynecomastia, to get rid of the fatty tissue around the breasts, rhinoplasty, nose jobs, and eye lifts. Brian opted for lipo.
No, the numbness is pretty much gone now. It's just...
Also gone, those love handles.
I dropped over 2 inches across above the belly button, below the sternum, right in there. That was 2 inches. And then I dropped a couple inches around my waist as well. I used to call myself pudgy. That's what it looked like. And it doesn't look like that anymore.
He says he's gone from pudgy to proud.
They're really proud of what they've done, so they're no longer hiding it. And it's no longer a stigma.
I don't think there's anything wrong with a person, be it man or a woman, trying to look good either for themselves or for a significant other.
But it can come at a significant price. How much should men expect to pay for plastic surgery?
Procedures can range anywhere from $3,000 and up, depending on what you're having done.
The procedure climbing to the top of the list of most wanted, gynecomastia. That will run you anywhere between $3,000 and $5,000. Here are before and after pictures. You can see how doctors got rid of fatty tissue in this patient's chest area.
Those are the areas that you just can't lose with exercise. You know, you can do all the exercise you want, go to the gym every day. A couple of areas are not going to go away.
The doc says what is going away is anxiety over aging.
It's not a big deal to me. I mean, it was a choice. I made it.
Are you happy you did it now?
Absolutely.
And the American Society of Plastic Surgeons say another possible reason for the increase in numbers is a tighter job market.
I guess they figure you're going to get a leg up on somebody else.
I guess so. I'm sitting here, I'm trying to figure out what I would get done. I don't know, maybe I'd get my nose fixed. I broke it a couple times.
Really?
It's kind of crooked.
It is not. People would have plastic surgery to get your nose. Well, something that certainly helps you look better, a good night's sleep, but it's not always possible. We'll hear how you can get those elusive Z's.
Plus something you can eat that may help you sleep easier, and it's natural. Honey. You put it in your tea and maybe even on your desserts, but do you know its many hidden health benefits?
Something that would put me to sleep, a massage. Up next, we'll learn about a unique massage technique, foot bar therapy.
But first, you know Delmarva Life is all about community. That's your community too.
Is there something going on in your neighborhood? We'd love to hear about it and see your photos from the event. Send the information our way along with any pictures you'd like to share.
You can reach us by email at comments@delmarvalife.com or like us on Facebook and share the info there. Delmarva Life, we'll be right back.